Good evening, YouTube. This is our future, and the power's with the people. Just want to let you know I am a respiratory therapist. Been doing this for 21 years. I've been kind of all over the place doing this. I wanted to show you our equipment room here. So we want to talk about COVID-19 for a few minutes. And the first thing I want to say is does it look like there's a ventilator shortage? There's not. Okay, as a matter of fact, we're running less ventilators right now than we would normally run, and that's because people are just staying home. They're not having elective surgeries. I want to talk about the numbers and the criteria that goes into what a COVID patient is, or a patient under investigation, what's also called a PUI. Basically, right now, the way it has been the last couple of months, when they locked us down, is that any patient that came in with a respiratory problem was labeled COVID. Now that doesn't matter if it's you got stage 4 lung cancer and pancreatitis and heart disease and liver failure and everything else. You're still, because you come in with breathing problems, you're labeled a COVID patient. Now we have one lady that could do the testing at first. That would go, those tests went to the CDC. Only one person was qualified to test that for the whole place. So several of these patients under investigations were never tested, and maybe they died or whatever. Then they would die of COVID and not of stage 4 lung cancer or these things. This is clear that this is what's come out. Every single patient that needs one of our pieces of equipment here, any of this, if they need any of this stuff, okay, then they are a rule out COVID. And these tests have taken as long as 2 or 3 weeks to get back. We're finally getting what they claim. They've been claiming this for a month. But we're finally getting in-house testing. That's going to change the game, and I think that's what's going on at most places. And what that also means is that now you're going to see the numbers either go up or go down. And I would suspect we're going to see them spike up and then spike down real quick. And this is the reason for the number of deaths. So you have to recognize that if every single patient is under COVID investigation and dies, then that goes into a COVID death, and they're showing the numbers like a football game to scare you. They're showing you loading bodies into a tractor trailer to scare you. I've never in my career ever seen bodies loaded into a tractor trailer. It just doesn't happen. I wonder if those were even bodies. I really don't believe it. All of this stuff is fake. Okay? Look at our ventilators. And let's talk about ventilators and why there would be a shortage of ventilators. Well, this is non-invasive ventilation here, CPAP or BiPAP. This is a mask that gets strapped on you, and we can help you breathe with that. We're not allowed to use those. Okay? We're finally opening up to where we can use them a little bit, but for the most part, since COVID came out, they said absolutely not. That's going to cause the virus to spread all over the place by spraying aerosols everywhere, and so we can't use it. You have to let the patient crash and go straight to a ventilator. Okay? Traditionally, that's not the way we would treat a patient. We also have aerosolized medications, bronchodilators. We're not allowed to use those either. So everything that we would traditionally do, we're not allowed to do. Every patient that comes in, no matter what their history, is labeled a COVID under investigation. So if that patient dies, that becomes a COVID death. Okay? So there's a lot of weird things going on. When it comes to the testing itself, I've been looking at this for about a month now, but you can also look for yourself. They were open about it on CBS News the other night. They're not testing for a virus. Like if you get sick, you go to the hospital, traditionally you get tested for flu A and B. Flu A, by the way, is H1N1, the one that killed everybody in 2008. They'll test you for RSV. Those are actual viruses that they will test you for. This COVID test is different. they're testing for an RNA sequence from a reaction to the virus. And look this up. Please look it up. They're not testing for a virus. There's not one test that tests for a virus. Okay. Then they put it in a PCR. It's a PCR test, which means it amplifies it. So if there's any one little shred of that RNA sequence from a damaged cell in your lungs or in your nasal passage, you're going to test positive. Now, that can come from cancer, that can come from radiation, that can come from several things. So, and then you hear all this talk on the news about antibody therapy and all this other kind of stuff, people wanting to donate plasma, everything else, but they're not talking about the virus itself. They're not testing for the virus itself, and that's a big, big issue, because that makes you say, well, is this as infectious as they're telling us it is? Because if it was as infectious as they're telling us it is, these would all be in use and everybody would be dying, and we're not seeing that. Okay? This is unbelievable. Every bit of this has been created, okay? If you cannot use the non-invasive ventilation and have to go straight to this, the ventilator, that creates a ventilator shortage. But you also want to ask, why is Ford and GM in the business of making ventilators when we have plenty of companies that already make ventilators? You know, what kind of ventilator is it? What does it do? Who's going to train us on those ventilators? And, you know, how's it going to be tested? And then, what is the cost per ventilator that the United States is paying Ford and GM for these products that really aren't obviously needed? So all this talk you hear on the news by the governors and everybody else, we're having shortages of ventilators. It's not true. It's not true. Okay? So how about healthcare workers? Yeah, we're getting 1 or 2 healthcare workers are coming up positive. And you know, that would be expected, but I would actually expect a lot more healthcare workers to get sick and come up positive. And we've had some extreme contamination issues from patients that didn't show any symptoms, wasn't a patient under investigation, and then all of a sudden came up positive, and none of those healthcare workers came up positive, got sick, carried a fever, or anything else. Just to show you real quick, here's my PPE that I have to wear. Sorry. Here's my PPE that I have to wear. There's an N95 mask in here and a face shield, and of course we got some gowns and stuff, but we're going wearing this for 5 shifts minimum before we can get a new one. All right, so I'm contaminating myself every time I put this N95 mask and the shield in this bag. It's contaminating. It's contaminating over and over and over again, and then I'm putting the mask on. Okay, I'm still here, I'm not sick, and nobody else is either, except with the exception of 1 or 2. If you look at the areas that these people are in, where the hot spots are, like such in Georgia's Albany and Atlanta, you really have to say, well, why are all these places happening in these condensed areas? Well, I truly believe this is something else that's causing this. All these patients have comorbidities. They're all older, the ones that are, you know, in life-threatening situations. And the mortality rate is really not that low. So if you actually look at what's going on compared to H1N1, H1N1 was a million times more scary than the COVID-19. When it comes to vaccination, you cannot vaccinate yourself really for a sinus infection. It's just not going to work. You can't vaccinate yourself for every little human element that there is. You know, people are going to get sick. What traditionally happens with viruses such as this, if this is a virus, and I'm not so sure it is, but you're going to have a real spike such as in SARS, Zika, H1N1. You're going to have a spike, and then it's going to lose its efficacy, and it's going to drop, and the mortality rate's going to drop. I mean, the people that get really sick is going to drop, you know, so you have this initial little bang, and then it drops off. That's what a virus normally does. I'm not completely convinced this is a virus, and I've been doing this a long time. Do your own homework, do your research, but the equipment should speak for itself. Does this warrant shutting down the country? Does this warrant $6 to $10 trillion in economic stimulus just for this country. Does this warrant all these things that are being put in place? I mean, does this warrant the trillions lost? Does this warrant locking everything up? Beaches, hiking trails, tennis courts, bars, restaurants, pool halls, schools. Does this warrant this? I really don't think it does. Not even close. So y'all need to be asking some really hard questions here, and questioning your government, and questioning the people in charge, and also questioning your doctors, because the doctors believe this stuff just as much as everybody else does, but they're not looking at the real information. All they're doing is they're told something, and hey, guess what? They got lives, they got jobs, they got everything else you got plus some. They don't care. I mean, they do care, but they're not going to go look it up. They're not going to look up exactly what this test is. They're not going to look up that, hey, why aren't we getting these infection rates? They look up the little things that they're told to look up, and that's it, just like anybody else would. Okay, so, these questions really have to be asked. And then for the Trump supporters out there, I want to ask you something. Think about this for a minute. We're doing the same thing they're doing in France. We're doing the same thing they're doing in Italy. We're doing the same thing they're doing in the UK. So, does that mean Trump's really in charge of this whole thing? Because I really don't think he is. I think he's being told to do what he's doing, and that's the way it is. I mean, this is a deep state, Illuminati stuff, and this is the real deal. And they're shutting the world down. Okay? Y'all people really need to understand this. The world. Okay? And they're putting our kids and grandkids in severe debt that will never be paid off. And if you think of how many taxes you're paying now, can you imagine what our children and our grandchildren are going to have to pay for this scam? So please look up, do your homework, ask questions, look at our equipment room, ask, why can't we use this if we're not seeing the infections? Why can't we use this non-invasive equipment? Why are we having auto manufacturers make ventilators? Who's testing the ventilators? What kind of ventilator? Price per ventilator? All these things. The economic stimulus package. Is this going to be another corporate bailout where they, give themselves $1 million bonuses while we starve? I bet you it will be. So this is a real dangerous time we're coming into. When it comes to the vaccination, I promise you.
It'll go viral. I'm sure I'm going to get some hate messages after this. Frankly, I don't care, because this could save someone's life. I'm a nurse practitioner. I am licensed and certified. I am not on the front lines. I have a friend in New York City who's on the front lines, and for her safety, she cannot come out and say these things, so I am her voice. I'm not going to name names of people or hospitals for the safety of those involved, but this is her account, okay? I am her voice here. I'm going to tell you what she has told me. She wants this to get out. Now, I'm sure this is not the case everywhere. I'm confident. I have friends that are in other places. They're on the front lines, they're in ICU, and it's not like this everywhere, but in New York City right now, in some of the hospitals, this is what is going on. People are sick, but they don't have to stay sick. They are killing them. They are not helping them. She used the word murder, coming from a nurse who went to New York City expecting to help. Patients are left to rot and die. Her words. She has never seen so much neglect. No one cares. They are cold and they don't care anymore. It's the blind leading the blind. Now, a couple of weeks ago, I was on with some nurse friends of mine, and we were discussing different medications that could be used to potentially help people. Doctors who were reporting around the country that they were using a combination of medications that were helping people. People were not dying when they were on these medications. They were getting better. Those medications are not being used in hospitals in New York City. What is happening is that they're putting people on nasal cannula. If they require more than 6 liters of nasal cannula, they get intubated, they go on the vent, or they get trached if there's not enough vents. They don't get high flow, no non-rebreather, no non-invasive ventilation, no CPAP, no BiPAP. They're on a closed system, the ventilator, versus a CPAP or a BiPAP for fear that it will spread the virus. Which, by the way, I know a nurse in Florida who was fired for exposing that about CPAP and BiPAP and patients being put on the ventilator, like straight away to the ventilator, to be on a closed system. The patients don't know any better. They don't have family with them. There is no one there with them to advocate for them. So they are scared and they give consent. The ventilators have high PEEP, high pressure, which then causes barotrauma. It causes trauma to the lungs. Dr. Siddell, Cameron Kyle Siddell, a few weeks ago put out a video. He's in New York City, and he put out a video saying something is not right, like we're not treating this correctly. We're doing something wrong. This doesn't make sense. They pulled his video from YouTube and they took him out of ICU because they couldn't have one doctor going against the grain, going against their protocol. The protocol is propofol or some kind of sedation because they're on the ventilator, and IV antibiotics. There's no hydroxychloroquine. They're not using that combination with Zithromax. They're not using zinc, vitamin C, high doses of vitamins A and D. They laugh. This is what she's told me. They laugh at that. She says this is a nightmare. It's out of a horror movie, and I don't want to be a part of this. There are people who are a full code, and yet, if they crash, they're not doing compressions because it will spread the virus. Full code, not doing compressions. Family is not there. They have no one to answer to. No one is being held accountable. A code was called and no one came. So sometimes they're not even resuscitating people. Again, left to rot and die. They're not given blood because we know that the blood is not oxygenated in these COVID patients. We know that. There are doctors all around the world sounding the alarms. These are the drugs that work. This is the pathophysiology of the disease. This is what's happening. And for some reason, it's not changing. Even though we know, some of us know what's going on, nothing is changing on the front lines. They stay in the same PPE all shift, except for the top pair of gloves. So 2 pairs of gloves, or I don't know, maybe more than 2, but they're only changing the gloves on the outside. Gown, mask, whatever else stays the same because all patients are COVID patients. So if it's a COVID floor, it's all COVID, but it's not because some of them are rule out COVID. So even if they're rule out COVID and they're not COVID, they're going to get COVID because they're using the same PPE all shift and they're carrying that contamination to all of the patients. They're not changing their PPE. They're not going into rooms. So they're running long tubing into the room so that they can manage the tubing from outside of the rooms. So if they're not going into the rooms, that means they're not assessing the patients as frequently as you would be otherwise assessing your patients. They are not doing rapid result tests. You're lucky if you get results in 5 days. Okay, this is coming from my friend who is in New York City right now on assignment, who went there to help, and this is what she's finding. It's a horror movie, she says. Not because of the disease, but because of the way it's being handled. She said we need help, and people are sitting there waiting in the hotels. Money, I guess, it's being paid for by FEMA, and yet they're still understaffed. And there are hundreds of people, hundreds of nurses in the hotels waiting to be called onto a shift. So there is manpower enough if the goal were to actually save people. But resources are not being utilized properly or to full capacity in a way that maximizes the patient benefit or improves the outcomes. The records and charting are crap. And now some of these hospitals in New York City are probably crappy on a good day. So you add in the fear of COVID and the fear of the whole pandemic and forget it. So if you're in a crappy hospital with crappy nurses, let's face it, all of us nurses have worked with crappy nurses before who don't care. So now you add in this, forget it. And they're having people do things that they can't do. So maybe things that they're not proficient in. So maybe a nurse who's not familiar or comfortable with using a ventilator. And it's that figure it out mentality. Figure it out. These patients are critical and they're crashing, figure it out. So nurses are being celebrated as heroes, right? We see how like the fire trucks and the police are like lining up and practically having these parades and celebrating them as heroes. And don't get me wrong, I'm sure in some parts of the country and other ICUs, I have friends that are working on the front lines in ICU and they are good nurses, and some of them are heroes. But we have nurses being celebrated as heroes who are killing people. They're not heroes, and they're being brainwashed to think they're doing something great just by going to work because they're brave enough to go to work. Well, what are you doing at work? You're certainly not saving people if you're not even running codes. You're not even going into patient rooms. You're a coward. You're hurting people. You're killing them. You're contributing to the problem. I know I'm going to get hate mail for this, and that's fine, because people are dying who don't have to die. Again, there's no family there, so no one's being held accountable. And once these people get intubated, they're being scared into giving consent to be intubated, and then for a lot of them, it's over. And there's nobody going to be held accountable. And there's nobody looking out for them. They are completely by themselves. There's like a total lack of critical thinking. It's out the window. And people are scared to speak up. And one person alone isn't going to change the overall culture of a hospital or a system or a city. Like I said, Dr. Cameron Kyle Seidel's video was pulled from YouTube. And he was pulled from the ICU for sounding the alarm and going against the grain. So people are sounding the alarm. It's just not changing anything, apparently. So what can you do? Buck the system. I'm really fortunate I don't have any family in New York City that I personally have to worry about. If there are people that you are worried about, or maybe it's not even New York City, maybe you're in another city that's being really hard hit and you're just hearing really bad things coming out of that city, buck the system. Something is wrong in the system. So go against the grain. Request records immediately. Records, transcripts, immediately. If there's a medication that you want your loved one to be given, report it as an at-home medication and demand that it be continued. That's just a tip from inside the system. If you want a medication to be given, you've got to report that it's an at-home medication and that you demand that it be continued. Your loved one is not going to have you in there advocating for them once they go in. You're not allowed in. The only reports that we're able to get of what's going on are coming from the inside, and people are afraid to speak out. People have lost their jobs. Do not give consent for intubation if you don't want to be intubated or your loved one to be intubated. Demand non-invasive or less invasive ventilation methods. As soon as you give that consent, you might not come out of it. Now, in some cases, it might be appropriate. We just don't know. We know that it's being used inappropriately in a lot of cases, and that the ventilators are making people worse. Please share this video, make it go viral. People need to know this. This is the truth of what's going on from my nurse friend who's in New York City right now on assignment. This is murder, she says. People are being murdered and no one cares. Horrible care.